more. Good. Hey everybody, it's Dr. Tyler at Sioux Center Chiropractic, and I'm here with Shayla today, and we've been working on Shayla. She's a college soccer player and originally came into us with some low back pain, and while we've been treating her for lower back pain, she ended up getting a concussion, so we've been treating her for the concussion as well. And anything else you want to share about kind of what's been going on, or when you're feeling your pain, or how you've been doing so far since we started?
Right, yeah. So I've noticed some improvement in my lower back pain so far. A lot of times it flares up when I'm playing a game. I also get like shoulder pain when I'm playing a game or neck pain. So yeah, we've just been working on something like that.
Great. And she just had a game last night, so we're going to watch her move a little bit first, take her through the top tier SFMA, then we're going to just motion palpate the joints and decide what we're going to do for care today. Probably a little bit of active stretching, and then we'll do a little adjustment at the end. And then she's also been working with our rehab team on getting a lot of these imbalances back in order so that she can go do her thing out on the field. So we'll start with you just standing right here, Shayla, and I'm going to have you, we'll look at neck first. We're going to look up at the ceiling as high as you can, down at the floor as far as you can. Great. And now I'm going to have you face me, and then we'll go feet together and just turn your chin to the left and right each direction. Do you have any discomfort with any of those in the neck? Great. We're going to look that way now, and then we'll check shoulder mobility today by having you take your left hand, reach behind your head, touch the top of your, or the bottom of your right shoulder, and then do the opposite arm. Great. So she's got a little bit of winging going on here, so that's something we've been working on. Was trying to get her rhomboids and middle trapezius to start activating, and her serratus anterior to start activating to get those shoulder blades down. We're going to let that go down, and now reach above and behind your head. So go ahead with, let your arms down, and then just reach over the top of your head one at a time. Yep. And then we'll do the opposite side. Great. Any pain with that in the neck or upper back?
Yep.
Now we're going to face your left, and we'll go feet together again. And I'm going to have you simply just try to touch your toes, okay? Go all the way down, back up. And now you can go above your head with both hands, look up at your hands, and arch back. Good. Any pain with that? I'm going to have you do a squat. Keep your feet together, keep your feet flat. You're going to hold your arms out in front and go ahead and try to squat as low as you can. Great. And then do one more and hold it briefly at the bottom. So at the bottom of her squat, one thing we're going to be working on is ankle mobility. This is a common thing we see in our office. There's a lot of limited dorsiflexion in the ankle, and you can see that her upper body's having to dump forward to make up for that lack of mobility in the ankle. So if we can open her ankle up a little bit more, you can come on up. That's going to allow her to get deeper into that squat, and it's going to allow her upper body to be more parallel with her shins, which is what we're looking for in that. We're going to do rotation pattern. I'm going to have you face this way, feet together. And then I want you to just twist your whole upper body to the right and left as far as you can, and just let your arms relax. There you go. Good. One more. Good. Other way. There's a little bit more limited going to the right. Did you feel any pain with any of that?
Get like cramps right here, kind of.
A little cramp.
Yeah.
One thing we'll see in a lot of our patients is if they are limited in that thoracic rotation, they will feel that cramping in the obliques. So that'll be something we'll work on with her today as well. Shayla, I'm going to have you sit on the end here, and I'm going to sit behind you, and we'll start with the pelvis, and I'm going to work my way up, and we're just going to challenge the joint. We're going to palpate and push into the joint. It should be nice and springy if it's moving properly. If it's not, and it feels like there's a real block at the end, that gives us an indication that we need to get in there and do an adjustment. So I'm going to start down here, if that's okay. And just tell me if any of these are tender, okay? Any pain with that? I'm going to move down just a little bit. Any pain with that? Okay. Do the other side. Any pain with that? A little lower. Lower. Okay. All right, we're going to work our way up into the lower back. A little tender there. And then we'll keep working our way up. She's actually got decent mobility in her TL junction, which is where her thoracic and lumbar spine meet. That's actually a common area that we'll see restriction. So she's pretty mobile there. And then as I work up more into the mid to upper back, I'm going to have you go ahead and bring your hands behind your head and bring your elbows together for me, Shayla. And then I'm going to just lean you forward. As I get up a little higher, is that a little tender?
Yeah.
I'm noticing as we get into like this T5, T4, T3 region, she's got a little extension restriction there today. And then I'm going to be in the lower neck, and just tell me if any of these are sensitive. A little sore here. I'm noticing a little bit of limitation in her CT junction where the lower neck and the upper back meet. That's pretty common, especially she's a college student. She's looking on a computer screen quite often or studying, reading. That's a common area we see with a lot of our patients for restrictions. How about here a little bit?
Yeah.
Yeah. Then in this upper cervical spine, anytime you're dealing with a concussion, there's usually like a whipping effect in the head and neck area, and this occipital area on C1, C2 can definitely be affected. These muscles are usually strained quite a bit with that as well, so that's one thing we've been working on with her. So I kind of know which areas that I want to adjust. Before I do the adjustment, I'm going to just actively stretch her out and try to get those muscles to relax a little bit more. Before we did this, we identified that she had a little bit of restriction in her hip flexors, so we want to get that moving, as well as your hip rotators here on the outside of the hips. And we find a lot of times when we get that hip mobility cleaned up, that takes a lot of pressure off of the lower back. So we'll do some stretching there. We'll do a little bit in the trap area and in the suboccipital area of her neck region. Then we'll adjust at the end and should be good to go. So to get your hips moving, I'm going to have you lay on this side first. And then you can just lay on your right shoulder and then slide forward a little bit. So we're going to be right kind of on the glute medius, which just falls right off your hip bone and right through here. So I'm going to place your foot on my hip if that's okay with you. And then I'm going to have my hand contact just right off the hip on the glute, okay? Perfect. All right. So you're just going to feel a little stretch as I go up. Do you feel that pull a little bit? So you just do a few passes right on the glute, and then we're going to add the rotation here next. So I'll be in the similar area. Now I'm going to drop you down, and then you're going to feel that ankle and foot kind of rotate in. You're going to feel that pressure increase under my thumb. You feel that? Pretty intense, or are you okay? You feel it right where my thumb is?
Yeah.
Good. Sometimes if a patient has like impingement in the hip, they'll feel a good pinch in the front of the hip when I'm doing this. So I'm always just careful when talking to them to make sure that they're not feeling that sensation.
I can feel that a little bit.
A little bit in the front. Then I open my mouth and she says that. No, that's good information. How's that? Does that back off a little bit on the front? Not really. While I got her on this side, we're going to go to the front and work the hip flexor. So now we're going to work on Shayla's hip flexor. We identified that she had some tightness there, and when the hip flexor, the main hip flexor muscle is called the psoas, and when that's tight, it can pull the pelvis forward, and that can create a lot of shear and compression in the lower back. So we're going to stretch that out on Shayla here next. Shayla, all you're going to do is once I get a contact, you're going to straighten the top leg, you're going to bring it back all the way, and then at the end, you're going to take the top arm and reach above your head, and you're going to feel a good stretch under my hands. We'll do a few passes of that, and then I'll tell you what to do afterwards, okay? So I'll be right here, straighten that top knee, bring it all the way back, very good, and then reach overhead. Good, forward. And then we'll do a couple more passes, all the way back, all the way overhead. Is that okay?
Yep.
Okay. And then this next one, we're going to leave the arm alone. I'm going to be on the iliacus muscle, which is right here, and you're just going to move the leg back, okay? Go for it. All the way back, forward, all the way back, forward. Is that okay?
Yep.
Perfect. I'm going to have you flip sides. We'll get the glutes and piriformis muscles, those hip rotators on this side. So same thing as last time. You're just going to let that rest here. I'm going to be right off the hip. I'm going to bring that up. A little pull. Any pinch in the front?
No.
No? Good. There. Okay. And then we're going to add the rotation. So then we'll let that leg drop down. Tell me if you get a pinch. Anything there? Pretty good. Good stretch.
Yep.
Great. One more. Perfect. All right, well, I got you on this side. We're going to stretch that psoas muscle. So you're going to just keep that top knee straight when I tell you. Bring it back all the way. And then we'll finish with the arm overhead. Go for it. Good. Forward. Another one. How does that feel?
Good.
Yeah? Compare it to the other side. What would you say? What's the difference? Less or more?
Less.
Yeah.
Definitely.
Now just the leg, okay? Definitely feels less on this side. So we know right hip, less pinchy in the hip, and just a little less restriction from what I can tell and from what she's experiencing under my contact here. Good. All right. I'm going to have you come back up, Shayla, and we're just going to work a little bit in the traps and the levator muscles, and then we'll get you on your back, and then we'll stretch the neck out, and then we'll do our adjustment. So for here, all you're going to do is shrug the shoulder up, and then you're going to reach, drop the shoulder down and reach to your left knee, and then chin down to the left, just like that. Is that okay?
Mm-hmm.
Then back up, then we'll go down, down, back up, we'll go down, down. Very good. And we'll do one more here. Great. Then we'll switch sides, Sheila. What was the score of the game last night, or the match?
2-2.
2-2. So it ended in a draw.
Yep.
How many more weeks are left in the regular season?
Regular season ends the last week of October, so.
Got a couple weeks. You guys are right in the hunt.
Mm-hmm.
So you guys are lucky and beat the rain. You play? You don't play tomorrow, do you?
No, normally we play Saturdays, but we don't have a game this Saturday.
The men play tomorrow?
I don't think so.
No. Get a little break this weekend, recover, which will be good for her. Get everything, more time to heal up. All right, Sheila, let's go on her back. And I'm going to just stretch her neck and especially these suboccipital muscles. And then we'll adjust her on her back. While I have her on her back, we're also going to take care of those hips and make sure those are adjusted well. We'll use some drops on the hips. We'll get her lower back and mid back. Okay?
Mm-hmm.
What are you going to do with your weekend off? You got big plans?
Oh, no.
No?
I'll probably have practice.
Yeah?
Yeah.
You guys, a lot less conditioning this time of the year, though.
For sure, yeah.
Yeah. Kind of staying fresh mentally and
Mm-hmm.
game plan, kind of an active recovery.
Yeah.
Practice on the day after a game, pretty light, or do you guys go?
It's
Pretty
about
hard.
normal.
Pretty normal
Yeah.
day. Okay, Sheila, I'm going to be right up here. We're going to get that adjusted first. I'll get your upper and middle back, and then the hips, and then I'll get you on your side, okay? All right. Right through here. That relax. Good. We'll be on this left side. Same thing. Just let your head drop. And wiggle your toes. Nice. All right. And then I'm going to have you sit up. I'm just going to put this board under you, and you can go on your back again. We'll get the thoracic spine right through here. Deep breath, Shayla. Let it out. And again, let it out. One more. And out. Good job. Back up. Then I'm going to remove this and then lay on your back one more time. Go. All right. And then what we're going to do, you're just going to feel a little tug on each hip. And then after that, I'll have you get on your right side, okay? Right through here. All right. And kind of hold the sides of the table just so you don't feel like you're going to fall off. A little pull. Good. Okay. We'll do the left. We'll pull here. Let it go. Good. And then I'm just going to get your ankles too while we're here. Good. Side. There. And midfoot. Okay. Lay on this side. Yep. Right through here. Bring your hip forward, just like that. And then relax, we'll go all the way over. Nice. Other way. Good job. And this side. We'll go knee up. Right through there. Perfect. Relax. One more. Good. Back up. Perfect. I'm going to have you stand right here, Shayla, and then just while you're looking straight at the wall here, go ahead and look up and down, left and right. Touch your toes. Reach above your head, look up, arch back. Good. Step back just a little bit, and then I'm going to have your feet together. Go ahead and squat as low as you can again. One more. Great. And then face this wall, and then I'm going to have you twist to your left and right. And then we'll do shoulder movements overhead. Touch the opposite shoulder. And do the other arm. Good. Underneath. And another one. Perfect. How's that all feel?
Good.
Yeah? Good. So we'll continue working with Shayla. She's going to go out and do a little bit of rehab after her adjustment, and then she'll have the weekend off to rest and recover and be ready to rock and roll next week. So thank you for watching. If you like our content, please like and subscribe to our YouTube page, and have a great day.